Today in The Modern Parent, drooling, crankiness, and sometimes tears can make teething an ordeal for both parents and babies. Children's Workshop offers some help on easing the pain. While timing varies widely, every child's experience is unique and different. Most babies begin to teeth at 6 months, but they can start as young as 3 months and go as long as after 12 months.
And it's kind of based on when you or your spouse or the dad or the mom started cutting teeth, because if you're an early teether, chances are your child might be an early teether.
The 2 bottom front teeth are usually the first to appear, followed by the 2 top front teeth. Classic signs and symptoms often include the ever-obvious drooling, crankiness, swollen gums, and chewing on anything they can get their hands on.
Drooling, snoring, and the drooling you really want to back up. The drooling you want to keep an eye on, because not only do their shirts get wet and their pajamas and their bibs, but their chin, if you're not paying attention to it, it will get raw, because it's constantly drooling, so you have to kind of keep an eye on that.
If your teething baby seems uncomfortable, there are simple tips you can consider, like teething rings, teething toys, or even a homemade remedy.
You can get a clean face cloth, cold water, let them just chew on it. And also there's gels that you can put. You're going to be careful. If you put too much, apply too much, that can numb the tongue and the gag reflex, and they won't be able to swallow as good because they can't feel it.
If you want to use over-the-counter remedies, consult with your baby's doctor before doing so.
A lot of parents, well, they'll check with their pediatricians, obviously, if it's a Tylenol or a gel. And you don't want to use too much Tylenol because it's a fever reducer. So you don't want to get them used to that.
Tracy says she liked to create her own teething solutions for her daughter, something you might try as a healthy alternative.
One of my favorite ones that I did, because I made my own food, was pureed fruits in the refrigerator. They were cold, and then when they were on the gums, it was a nutritious snack that they were getting, but it was also soothing their gums.
There's also a surprising sign to be aware of when your child is cutting their first teeth.
One of the other things that children may do because their teeth hurt is fast. They don't want to eat. So you really want to keep an eye on that.
Here's the good news about teething. Your child probably won't remember any of it. For more information on the Children's Workshop, you can visit foxprovidence.com.